Most of us dentists make night guards for our patients, but how many of your patients actually wear those night guards? In this video, I'm going to walk you through how to make a night guard your patients will actually love, not just tolerate. One they can't sleep without, and when it breaks or wears down, they'll be rushing to your office for a new one. But before I show you the design, it's important to understand why some patients hate their night guards, why others tolerate them, and why some actually are getting worse because of the night guard. The most common thing I hear from patients who come into my office after having night guards made elsewhere, it kind of sounds like this. It's too tight, or it hurts my jaw, or I can't sleep in it, it makes me choke, it makes my jaw click. And what do many dentists do when they hear these complaints? Nothing, because they don't know what to do. Here are some of the things I hear from dentists when I ask what type of night guards they routinely fabricate for their patients. All my patients get blank, this one typical night guard. These are the dentists who believe every patient needs the same design. But same design for everybody equals failure for many. Or another one I hear is, I just sent the scan to my lab and they know what to make. These dentists rely completely on their lab technician to decide what's best. Or what about this one? I put everyone in CR. That's where the jaw needs to be. These dentists are following a textbook concept without considering what the actual joint or symptoms are telling them. And frankly, most dentists just don't really know how to design a proper night guard. So when the patients complain, they assume the problem is the patient. So what do you need to know to fabricate a night guard your patients will actually wear and love? Here are 5 things to assess before you even start. Number 1, does your patient have a joint issue or a muscle issue? Think of clicking, popping, limited opening, ear pain, fullness, tinnitus. That's a joint issue. And if that's your patient, you can't throw them into a typical night guard or they will feel worse. Number 2, is there anterior tooth wear? Front teeth do not equal back teeth. So wear in the front is different than the back. Anterior wear usually means a different reason for grinding. These patients will also feel worse in a standard night guard and often won't wear it. Number 3, do they have a deep bite? Deep overbite may mean a retruded mandible. If you give them a typical night guard, it'll feel wrong because it doesn't consider where the mandible actually wants to be. Number 4, lingually tipped posterior teeth. These are red flags for lateral interferences. A typical night guard just duplicates the problem because it copies the current bite and its issues. So look for things like abfractions, gum recession, crazed lines, or wear facets. Number 5, are they missing bicuspids from past ortho? This is a big one. Patients who had bicuspids extracted often end up with retruded mandibles, even if their teeth look straight. A typical night guard will keep them stuck there or push them back further. So bottom line, for most patients you're recommending a night guard to, you can't make the same old kind. A standard lab-made night guard usually just duplicates their bite or retrudes the mandible, and both equal more discomfort. So why this happens and how to fix it? Well, when you scan or take an impression, you capture the bite with the patient's teeth biting down. And then you send it to your lab, they open the bite to make room for acrylic. And the way they make room for acrylic and the way they open the bite is by opening it on a hinge, whether it's virtually or with a hinge articulator. But here's the problem. When the teeth are biting down, that doesn't mean the jaw is in the correct position. Many of these patients, it's not. And they're simply biting down wherever their teeth happen to touch the most. But when you open on a hinge from the patient's biting position, here's what really happens. When you open on a hinge, you distalize the lower teeth. When you open on a hinge, you distalize the mandible. And when you open on a hinge, you distalize the condyle. And that means you're compressing the tiny blood vessels, nerves, ligaments, everything sitting right behind the condyle. And in a healthy joint, maybe that's tolerable. But in a patient who's already slightly retruded, you just made them worse. Some patients feel pain, some feel tension, And some just say, I don't know what it is, it just doesn't feel right. And so they don't wear it. So here's what you need to do to make a night guard that feels good and supports the jaw joint, even if there's already a TMJ issue. You want to build it in a position where the muscles and the anatomy want the mandible to go. If there's anterior tooth wear, line up the wear facets. That's where the muscles are trying to take the mandible. Tooth wear is like tire tracks. It tells you where the patient's trying to go. You've got two bite options. So here's bite number one. Have the patient slide their jaw forward until the anterior wear facets line up. Take the bite in that position. Then tell your lab, open from this bite, not the original one in MIP. And then at insert, check for even posterior contacts in that wear facet aligned position. Then, if you want to fine-tune it with canine rise and anterior guidance, you can go ahead. Bite number two, use a leaf gauge, but not the way you were taught. You're not putting them in CR. Use it to set the thickness of your night guard, then have the patient slide their jaw forward until the anterior wear facets meet or are aligned. That's where the condyle is not compressing anything. And then you take the bite from there. Again, instruct the lab to fabricate from that bite. And at insertion, same thing. Check for even contacts and then fine tune from there if needed to make canine rise and anterior guidance. Hope this helps you make better night guards and fewer remakes. Drop a comment below and let me know what your experience has been like. And don't forget to like and subscribe so you don't miss future videos. Thanks for watching.